Doctors/biologists of Reddit, what is the most terrifying disease you can get? Rabies. It's exceptionally common, but people just don't run into the animals that carry it often. Skunks especially, and bats. Let me paint you a picture. You go camping, and at midday you decide to take a nap in a nice little hammock. While sleeping, a tiny brown bat, in the rage stages of infection, is fidgeting in broad daylight, uncomfortable, and thirsty, due to the hydrophobia, and you snort, startling him. He goes into attack mode. Except you're asleep, and he's a little brown bat, so weighs around 6 grams. You don't even feel him land on your bare knee, and he starts to bite. His teeth are tiny. Hardly enough to even break the skin, but he does manage to give you the equivalent of a tiny scrape that goes completely unnoticed. Rabies does not travel in your blood. In fact, a blood test won't even tell you if you've got it. Antibody tests may be done, but are useless if you've ever been vaccinated. You wake up, none the wiser. If you notice anything at the bite site at all, you assume you just lightly scraped it on something. The bomb has been lit, and your nervous system is the wick. The rabies will multiply along your nervous system, doing virtually no damage, and completely undetectable. You literally have no symptoms. It may be 4 days, it may be a year, but the camping trip is most likely long forgotten. Then one day your back starts to ache. Or maybe you get a slight headache? At this point, you're already dead. There is no cure. The sole caveat to this is the Milwaukee Protocol, which leaves most patients dead anyway, and the survivors mentally disabled, and is seldom done. See below. There's no treatment. It has a 100% kill rate. Absorb that. Not a single other virus on the planet has a 100% kill rate. Only rabies. And once you're symptomatic, it's over. You're dead. So what does that look like? Your headache turns into a fever, and a general feeling of being unwell. You're fidgety, uncomfortable, and scared. As the virus that has taken its time getting into your brain finds a vast network of nerve endings, it begins to rapidly reproduce, starting at the base of your brain, where your pons is located. This is the part of the brain that controls communication between the rest of the brain and body, as well as sleep cycles. Next you become anxious. You still think you have only a mild fever, but suddenly you find yourself becoming scared, even horrified, and it doesn't occur to you that you don't know why. This is because the rabies is chewing up your amygdala. As your cerebellum becomes hot with the virus, you begin to lose muscle coordination and balance. You think maybe it's a good idea to go to the doctor now, but assuming a doctor is smart enough to even run the tests necessary in the few days you have left on the planet, odds are they'll only be able to tell your loved ones what you died of later. You're twitchy, shaking, and scared. You have the normal fear of not knowing what's going on, but with the virus really fucking the amygdala, this is amplified 100-fold. It's around this time the hydrophobia starts. You're horribly thirsty, you just want water. But you can't drink. Every time you do, your throat clamps shut and you vomit. This has become a legitimate, active fear of water. You're thirsty, but looking at a glass of water begins to make you gag, and shy back in fear. The contradiction is hard for your hot brain to see at this point. By now, the doctors will have to put you on IVs to keep you hydrated, but even that's futile. You were dead the second you had a headache. You begin hearing things, or not hearing at all as your thalamus goes. You taste sounds, you see smells, everything starts feeling like the most horrifying acid trip anyone has ever been on. With your hippocampus long under attack, you're having trouble remembering things, especially family. You're alone, hallucinating, thirsty, confused, and absolutely, undeniably terrified. Everything scares the literal shit out of you at this point. These strange people in lab coats. These strange people standing around your bed crying, who keep trying to get you drink something and crying. And it's only been about a week since that little headache that you've completely forgotten. Time means nothing to you anymore. Funny enough, you now know how the bat felt when he bit you. Eventually, you slip into the dumb rabies phase. Your brain has started the process of shutting down. Too much of it has been turned to liquid virus. Your face droops. You drool. You're all but unaware of what's around you. A sudden noise or a light might startle you, but for the most part, it's all you can do to just stare at the ground. You haven't really slept for about 72 hours. Then you die. Always, you die. And there's not one fucking thing anyone can do for you. Then there's the question of what to do with your corpse. I mean, sure, burying it is the right thing to do. But the fucking virus can survive in a corpse for years. You could kill every rabid animal on the planet today, and if 2 years from now, some moist, preserved, rotten hunk of used-to-be brain gets eaten by an animal, it starts all over. Biologist here. I'm gonna go with prion diseases. They can hang out in your body for decades before causing symptoms, have no known treatments, and are very difficult to destroy. I'm also personally uncomfortable with the idea of proteins in my body misfolding. My nightmare scenario is a CWD becoming transmissible to humans. Fatal familial insomnia is a prion disease, right? I'm going with FFI. Fuck that shit. Anton syndrome, maybe not the scariest but definitely still very strange and distressing. Essentially you get bilateral visual cortex strokes, with some parietal cortex damage, so you're completely blind. But you don't know you're blind. These people will swear on their mother's grave that they can see, but then walk straight into a wall. Imagine going the rest of your life genuinely believing you can see, despite constantly being told otherwise. Edit, I had originally called this Anton Babinski syndrome, which is a related but different condition. A relative of my ex had a stroke that made his brain replace any surface he saw with hair/fur. Everything was hairy, from the room floor to his own face, which made shaving a really weird act. Not as bad as Babinski and he could live with it, but it led me to a lot of questions about the fabric of reality. Resident doctor here. A terrifying type of illness I haven't seen mentioned yet are head and neck cancers in general. They tend to have high suicide rates compared to other cancers due to the terrible quality of life they can have due to masses pushing into their airways or esophagus. Had a patient not long ago with a kind of throat cancer caused by HPV, which led his bottom teeth needing to be removed and not being able to eat solid food. My brother died of throat cancer at age 45. 6 months from diagnosis to death. It was beyond brutal. In the end I know he gave up mentally because his quality of life was gone. Absolutely gone. It was terrifying to watch. Terrible deaths. Rabies, Creutzfeldt-Jakob disease, anything that causes locked-in syndrome, Huntington's disease for the sheer pain aspect, but also can have shitty deaths. Trigeminal neuralgia, complex regional pain syndrome, epidermolysis bullosa, osteogenesis imperfecta ors. Have a degree in a biology field and will study pathology more in the future, plus also was in the funeral industry for 3 years. I have trigeminal neuralgia. It sucks, but it's definitely not my worst pain condition. Not being able to eat, brush your teeth, wash your hair for anywhere from a day to 2 weeks at a time is really unpleasant and detrimental. There are medications that help a bit, procedures that can help more. I've had good success with both that have my daily pain down to about 2/10 and my flare-ups only get to about 7/8. I've been using CBD oil on my face when a flare-up is happening or likely to happen, and it's worked extremely well. I have to avoid cold air on my face, touching my face too much and moving my neck/shoulders in certain ways. Brushing and washing my hair is also a trigger, so I only do it every 4 to 5 days. When you have chronic pain it can feel really hopeless sometimes, especially since you can be told that there are no treatments out there for you. I was told that, and there are loads of treatments, lots of options, and I found a great doctor who helped me. I would say Alzheimer's. Imagine forgetting everything and everyone you loved. Imagine slowly forgetting how to do things, how to walk, eat, drink and talk. Eventually you die because you forget how to breathe. To me that's pretty horrifying, and think of the family members who see them going through that. My grandmother had Alzheimer's. I think it's worse for the family because they see the person changing and forgetting. The person isn't fully aware and don't realize they are essentially living in an alternate reality at times. Still sucks for all involved though. Interesting thing though, when my grandmother's Alzheimer's progressed to a certain point she stopped being racist. My grandmother also had Alzheimer's, and I agree, with the exception of one phase. There is a phase where they are half there and do realize they aren't all there. That was the hardest phase. My grandma knew she should know me, but didn't know my name or relationship to her. And I could tell she was upset she didn't know. It was actually a relief when she progressed beyond that and didn't know me at all. The worst I feel is dermal lymphoma. You get tumors on your skin that turn into open sores. In extreme cases 70% of your body is covered with weeping painful sores. Just changing the bandages can take 4+ hours and requires opioids for the pain. You are constantly at risk for sepsis, which will kill you. Horrible way to die. For something that's fairly common, cirrhosis. Your liver has failed, you're waiting for a transplant if you're even eligible for one. You have to get your belly fluid drained every week. If you stop taking your lactulose or having BMs, you will get confused. You can get terrible, life-threatening episodes of vomiting, pooping blood because of your varices. Your liver failure can actually lead to kidney failure, shortening your lifespan even more. You're basically dying slowly and your family is being burdened with your illness. I have a friend from high school that was diagnosed with cirrhosis and liver cancer. They took care of the cancer and she resumed drinking. I saw her post Christmas pictures and she was yellowish. She's ashamed and not reaching out to people. I sadly don't see her living much longer and we are only 50. I've noticed that once the skin and eyes start turning a deep yellow, they're usually close to death. And it's really tough to watch. This is how my mom died, from Hep C in 2002. After she was diagnosed, she was gone in about 2 years. Wasn't a drinker/drug user, but got Hep C from her boyfriend, who also died 1 year later. The hallucinations and delusions were the worst part honestly. After I saw my mom go through that, it was a matter of days before they took her off life support. She was 47. Thank you for listening to another episode of Tales of Reddit. If you liked this video, make sure to drop a like. Also leave your thoughts in the comments below. Have a nice day.